Abdominal pain is visceral, parietal or referred. Anybody complaining of abdominal pain, you should not get carried away. There is the intra-abdominal structures only. It can be abdominal structures, it can be extra-abdominal. Even a myocardial infarct can come with the epigastric pain. Even the neurogenic pain can come with abdominal pain, correct? And the vertebral body pain can come with abdominal pain. So you have to be very careful when you evaluate abdominal pain. I have had so many cases where people are investigated, so many gastroscopies, colonoscopies, ERCPs, everything done, and not realizing that pain is not abdominal and pain is outside. One of my own relative staying next door, my immediate next door neighbor, 10 years back, came to me one morning. Chetan, I got a very severe abdominal pain on my right side, strongly diabetic. Right side abdominal pain. Think of appendicular pathology, cecal pathology, ileal pathology. So I said, okay, take this anti-amoebic treatment and see. Next day, what medicine have you given me? My pain has increased. Your medicine has reacted with me. I said, I don't think so, but anyway, continue for one more day. Didn't feel better, restless. Got a CBC done, CBC normal. X-ray abdomen, normal. Sonography, normal. I didn't know what to do. I waited for one more day, severe abdominal pain. I got a barium meal follow through done on the 5th day, normal. So barium normal, sonography normal, plain X-ray abdomen normal. Severe abdominal pain continuing. He lost faith in me. He said, Chetan, what are you doing? I said, I'm sorry, but I can't figure out what's wrong. Abdomen absolutely soft. No lump palpable. Abdomen soft, but severe pain in right iliac fossa. On the 9th day of pain, he got vesicular eruptions coming from the back on this area and diagnosed herpes zoster. So that made me wiser, and I realized that referred pain also can come in the abdomen. And with that knowledge, about 6 months later, I had another patient, private patient. They called me for a home visit. Severe abdominal pain hai. The lady cannot walk, cannot get up, and she is in a very severe pain. You have to come home for the visit. I normally don't go for visit, but that day I went for a visit. I don't know why. I sat down. I asked, where is the pain? She said, doctor, pain on the right side, very severe pain. I said, where does it start? That lady was seen by 3 gastroenterologists, 2 colonoscopy, 3 times gastroscopy, CT scan abdomen, sonography abdomen 5 times in 2 years, and nobody could diagnose that. I said, where is the pain? She said, pain is here. I said, where does it start? She was not sure. I examined, abdomen soft, absolutely soft. I turned her, I examined the spine, perispinal, big abscess. I said, this is TB vertebra with cold abscess, with the collapsed vertebra and neurogenic pain. I said, you do CT MRI spine. MRI spine, husband came, sub D4, D5 totally destroyed and big abscess in that area. Admitted in hospital, abscess drained, AKT started, 5 days pain disappeared. So this is referred pain. You have to be very careful. Epigastric pain can be myocardial infarct. So you cannot say that abdominal pain is always from the abdominal viscera. You have to be very careful when you think about the pain. Visceral pain is a bowel pain which is arising from any part of the bowel, esophagus to rectum, any part. It's very poorly localized and it is mainly centrally situated. Parietal pain, and there may be a secondary autonomic effect may be present. Diaphoresis, restlessness, nausea, vomiting, and person may appear pale. So this is a classical visceral pain. And visceral pain, this is a characteristic of visceral pain. In my clinic, somebody complains of abdominal pain, I have got a very standard point. I got assistant doctors, they take history, I listen to their history, then I ask only one question. एक उंगली से बताओ pain कहाँ है? If pain is in the upper abdomen, umbilicus or lower abdomen. If the person puts pain on a side, if the person says pain idhar hai, it is not abdominal pain. Any pain arising on the side lateral part of the lumbar region. This is abdomen, this is not abdomen. Any pain here, it is not intra-abdominal pain. It is retroperitoneal pain. It can be pancreas, it can be renal, it can be ureteric pain, or it can be retroperitoneal structures. Correct? So abdominal pain has to be in midline. Any part of the GI tract has to be midline. So here we have number 1, number 2, number 3. Any pain in the epigastric area, lower esophagus, stomach, duodenum, pancreas, gallbladder, liver, left lobe, 5 structures. So esophagus, stomach, duodenum, gallbladder, liver and pancreas, this pain can come in epigastric area. Gallbladder pain can also come in epigastric area. Duodenal pain will come in epigastric area. Now, when I say this epigastric area 1, 2, 3, 4, 5, I always tell everyone, don't forget the referred pain in epigastric area. Referred pain comes from the pleura, it can come from the lower parenchyma of the lung, that is lower lobe of the lung, it can come from the mediastinum, it can come from the cardiac structures, correct? That pain also can come in epigastric area. And from the GI structures, ileocecal area, ileocecal pain, terminal ileal pain, cecal pain, appendicular pain, Meckel's diverticular pain can also come to the epigastric area. I have had so many cases in the last 25 years where person complains of epigastric pain. Every time the upper GI endoscopy has been done or sonography abdomen has been done, normal, reported normal, and 6 months or 1 year later there is ileocecal pathology. Is the Cox or appendicular pathology or Meckel's pathology. So when that pain is referred to the epigastric area. So what is my way of diagnosing that? If patient says pain idhar hai, I press here, there is no tenderness. My next is gallbladder, liver, and fourth is I press the appendicular area, the right iliac fossa. If there is a pain here, when the patient complains of pain, ask next question. When I press here, do you experience the same pain which you get here? Normally they say, doctor, I don't understand. I say, okay, see, is it hurting you? Nahi sir. Is it hurting you? Yes sir. Achha. When I press here, do you get pain here? Yes sir. When you press here, I'm getting exactly the same pain what I normally get. It's ileocecal pain. You don't have to do too many investigations. Clinical medicine is the best medicine to practice. Before you get up from your chair to examine the patient, in 90% of cases, we have your diagnosis. And if you can't make up the diagnosis, 1, 2, 3 differential diagnoses, believe me, trust me, when you examine, you don't get diagnosis. Only 5% of cases, you get diagnosis on examination. And remaining 5% may be investigations or maybe nobody can diagnose if you can't diagnose. Before you get up from your chair, you have to have 3 differential diagnoses in your mind before you touch the patient, only from the history taking. And that knowledge comes with your reading and your experience. Only when you read, then you get it. People say 2 things. You learn with experience or from the experienced. Correct? So somebody who has already gone through this process before you, he passes on the knowledge to you. Or you learn over a period of time. Unfortunately, I had to go through hard way and you have got a simple way to learn. So that is number 1. Number 2 pain is the periumbilical pain. Pain in the periumbilical area, that is mainly small intestine, right from the jejunum onwards. Duodenal pain comes in upper abdomen. Jejunal pain comes in